Good morning, everybody, and welcome to our latest update in terms of events and festivals. We're going to spend a few minutes just talking through some of the indicators that we established back in May of last year, which have been quite a helpful guide for us. But also we'll talk a little bit about some of the other determinants, the other considerations in terms of events as well. I'm delighted to be joined again by Gemma from Public Health. Good morning, Gemma.
Morning, everybody.
So these are the indicators that we looked at, and I'm going to immediately hand over to Gemma, and we can talk about some of the issues in terms of where we are on prevalence rates, our rates for our more high risk groups, but particularly looking at things like vaccination rates and hospital admissions as well. So Gemma, over to you.
Yeah, thanks, Jonathan. Okay, I'll share my screen as per usual. There we go. Right, hopefully you can see that okay. Oh, that's just me just switch back. I don't know why that's done that. Excuse me a moment. There we go. Okay, so it's no surprise, obviously, as we look at our July figures, you know, that they have shot up completely across the county. We've got the highest at the moment in North Warwickshire. It's 855 per 100,000 population. And just looking, you know, where we've come from, sort of June time, where it was kind of 15. It shot up there, you know, straight up to, you know, into the hundreds. So we know we're having a rise in cases. We know it's because it's the lifting of restrictions, and we are seeing that in Warwickshire, as you can see here, all of our district and boroughs, as much as the rest of the country is. So with regards to that, this chart here, so we've got, if we look at the last 3 weeks here, and then down under that you've got the age categories, and then you have obviously the dates, so over the last 3 weeks. You can see the darker colours mean the higher infection rates. So you can see, obviously, you know, really dark colours here in the kind of 20 to 29 groups, 10 to 19 groups, and again 30 to 39. So it's the groups that were, you know, sort of last to get vaccinated, perhaps haven't maximised the uptake yet, etc. So that's where we're seeing the largest numbers, which again reiterates the importance of the vaccinations. So if I look at vaccinations, so this is our vaccination uptake across Warwickshire. We've got the blue line being dose 1 of the COVID jab and the pink line being dose 2. So we look at Warwickshire as a whole. At the bottom here, we've got 65%, so well over half of the population now with 2 vaccinations, which is great, and then 82% with 1 dose. On the right hand side, you can see the age categories here, and it sort of aligns with the previous chart that I showed, which is that obviously there's lower uptake in the lower age groups, only because they were sort of, you know, later to start uptaking, but it directly relates to then the sort of the number and severity of infection. So yes, that really kind of reiterates the fact that we need to be vaccinating, and the importance of this. So if I come back here and stop sharing the screen, there we are.
Thanks, Gemma. That's really helpful. And I suppose if people are organising events at the moment, so organising festival events, one of the key things to consider is the age range people who will be attending that event, and work with us, work with our colleagues in public health about trying to encourage people in those age ranges to get vaccinated. That's definitely seeing a really big positive impact in terms of how we're controlling transmission, and that's probably why we're not seeing the increase in hospital admissions, because of the actual elements in vaccination. I know our hospital admissions, we have seen younger age ranges, haven't we, within our hospital admissions. So if you're organising events for people, particularly in that age range, you know, older teenager, young adults, that's where we would do a bit of scrutiny, a bit of focus, because of where the rates are right now and where the prevalence is within our communities. What's your thoughts on LFTs and PCRs for people organising events, Gemma?
Yeah, so I think at the moment, especially, it's a really, really important tool to be using to kind of, check people out before they're entering events. LFTs obviously give you that kind of instant result, and then PCRs have sometimes been brought in with a really high risk events. It might be, the age of the people who are attending, or the numbers and the kind of environment in which that's happening. But
Yeah.
both of them are brilliant, and yeah, encouraged to use.
Brilliant. And we've definitely seen some positives, haven't we, where people have used LFTs, which is really, really good. And I suppose the other thing we would highlight today is if you're running an event where you're actually getting people from across the country coming, please come and talk to us about that, because we can provide you the data that looks at the evidence for those other areas across the country, and then give you some ideas of other control measures you can put into place. So we hope that's a helpful update for today. Please come and talk to us. Any issues you've got, get in contact. We're here to help, and we'll keep these blogs going over the coming weeks. So thank you, Gemma. Thank you, everybody, for joining us.
No worries. Thanks, Jonathan.